This is NewsBreak26 in Southwest New Brunswick. I'm Vicki Hogarth. Here's what's happening in our part of the world. New Brunswick is now recording over 1,000 new cases of COVID-19 a day, and there are likely more going undetected or unreported thanks to the now limited use of PCR testing. Chief epidemiologist for the province, Mathieu Chalefou, is projecting that New Brunswick will reach the peak of the fifth wave that's being propelled by the highly contagious Omicron variant in a few weeks, likely by the end of January or beginning of February.
At our peak weeks, we can expect over 5,000 New Brunswickers developing the disease daily. Over a 5-day period, this would be about 25,000 individuals. Assuming 2.3 individuals per household, this could mean over 7%, or approximately 55,000 people, isolating at any given moment. When you factor in longer isolation periods, for example, for unvaccinated children, this number will likely be higher. This will impact not only our healthcare system, but also other critical services, such as fire departments, police departments, power services, and so on and so forth.
On Tuesday, January 11th, New Brunswick reported having a record 88 people in hospital with COVID-19. The province is forecasting 220 active hospitalizations by early February. Also putting a strain on the healthcare system, there are currently 377 healthcare workers who have tested positive for COVID-19 and are isolating.
As we know, the Omicron variant is highly transmissible, and though milder than the Delta variant, it is by no means mild. For every 1,000 cases under Delta, we would have expected 60 admissions. With Omicron, we now expect 10. While better, this is still enough to put our health system at risk due to the sheer volume of cases.
With the peak of the Omicron variant still a few weeks off, the province is moving closer to hitting the threshold that would trigger a move to Level 3, the most restrictive level of the province's winter plan. To move to Level 3, there would need to be a total of 100 people with COVID-19 in hospital or 50 people in intensive care. Although Dr. Jennifer Russell says public health is holding off on moving to the more restrictive level until the level requirements are met, she is urging New Brunswickers to limit their contacts as much as possible to help reduce the spread of the virus.
The briefing today is really about how to make sure that New Brunswickers understand the situation as it is today, what actions they can take personally, again, around keeping their close contacts low, getting vaccinated, getting boosted, etc. Those are really important things to keep in mind right now, and we will continue to monitor the situation extremely closely.
If a move to Level 3 is triggered, New Brunswickers could expect to see a similar reality to what we experienced at the beginning of the pandemic almost 2 years ago. In Level 3, only essential retailers can be open. Spas, salons, gyms, and entertainment centers are closed. Restaurants can only do takeout. Faith services must move outdoors or online. And New Brunswickers must limit their social circle to their own household. Vaccinations remain our best defense against hospitalizations, and currently all New Brunswickers 18 and older are eligible for a booster dose if at least 5 months have passed since their second shot. That's all the news I have for you. For more stories and live-streamed COVID-19 updates for New Brunswick, follow us on Facebook at CHCO.TV.
A news and public affairs production of CHCO-TV, New Brunswick's only source for independent community television.